So testing is improving. We are seeing new tests within an hour. In our community hospitals, we're going to be probably in the next week to 10 days, we'll have faster results and turnaround time. Right now, our turnaround time is 3 to 5 days. We're waiting 3 to 5 days in this country right now, or even longer, to obtain results from patients who have been tested. And hopefully within the next 7 to 10 days, or 2 of our local community hospitals will have a faster test within about an hour. And that will be very important to be able to diagnose earlier, to address the concerns earlier. And this raises the question, everybody keeps saying for the last few weeks, why aren't we testing everyone? Testing everyone is probably not going to answer the question, because you could be asymptomatic today, be tested negative, and then tomorrow you could be symptomatic and be positive, and you may have that false sense of belief that you're now negative. Because in a matter of a day or 2 days, you can become from negative to positive, depending on your symptoms. So here we go from one extreme. We may think we're on the testing, but we got to be careful. We're not over testing at the time when we don't have enough of these tests available. We're seeing a shortage in New York right now. We're hearing healthcare workers are using plastic bags as a protection device, and we're using masks, surgical masks, and we're reusing these masks, washing them and reusing them. So there's a lot of those questions, and there's no correct answer this time. The correct answer is to provide masks every single day to every single healthcare worker for every patient they see. That will be the correct answer. Can we do that? No. We are overstressed at the present times. And that's it. They just have to keep doing the best they can. There's no good answer, because they're not getting the supply chain demands that they should expect in a developed country. At this time, we shouldn't be having this question about masks. We should have enough masks, but we don't. This is a huge supply chain issue, and why is it that we're still grappling with this? Having known that this was going to happen 6 to 8 weeks ago, we should have been definitely more prepared than this. Hospitals, the government, the healthcare system should have been way more prepared than what we're seeing now. This was predicted by China, by Wuhan, about 3 months ago. We should have learned from the lessons from there. I think we were not cognizant of the fact that this is going to be as severe as this, even though the warning signals were there. But we should have had better masks, better protective equipment for our healthcare workers. But now that we don't, what can we do? We can use whatever we can. And can we look at pre-exposure prophylaxis, meaning that healthcare workers who are in the field, can they now have starting medication? That's in discussion. We look at what we call post-exposure prophylaxis, meaning that you've been just exposed as a healthcare worker. Can you start some medications such as Zithromax or chloroquine at a dose that is not toxic to prevent this virus? These are all the good questions that are researched. And what is the government going to do on a large scale? So that's a great question, and we're doing a lot of telemedicine, and liability has been a massive issue for providers around this country. We're supposed to be the best in healthcare in the world, yet when you look at the content, the unimaginable amount of liability issues providers face, nurses face, emergency room, first healthcare responders. The easiest thing is to say, let's sue someone. And even in this crisis, as providers, we're very worried about this. I would be very excited if I can see some healthcare reform change right now. Why is it that healthcare providers in this pandemic, in this epidemic, have to still be concerned? Legal issues of doing the right thing when we're doing the right thing. I really do think the government needs to get involved and be much more aggressive about this. I really think the government needs more involved. This is a nationwide crisis. And to see advertisements on television about lawsuits and issues going on right now, and some friends of mine are dealing with lawsuits, this is ridiculous, to say the least. Well, let's look at Japan. Japan has about 9,000 cases. But you know what Japan did? They shut everything down. India, of 1.3 billion people, are shutting the country down. We would never conceive this a few months ago, that countries as large as these can actually be so serious about a healthcare crisis. This is a healthcare crisis we've never conceived. We've talked about it for years. We've said what are the strategies we would do, and here it is, right in front of us. And now is the time to act. Now is the time to address the issues. So the question is, how long is this lockdown should be or could be? I think it all depends. It shouldn't be a time. It should be determined by the graph, by the plateau, by how there's a decline of infections over time. That's what should determine a lockdown, not 2 weeks or 4 weeks or 6 weeks. It needs to be as long as possible until we can bring the virus down, the new cases to decrease. As we saw of 200 and something deaths yesterday, of over 200 deaths yesterday, today will be over 300, tomorrow will be over 400. And then what are we looking at in the next few weeks as the increase in death? When are we going to be asking the question about duration of lockdown? I do believe the lockdown should be as long as necessary until there's substantial decrease in new cases. Hopefully not, because as we can clearly see, there may be actually different strains of this virus. And why am I saying this? Is because we clearly can see there's a milder form where the patient will have a rhinovirus sort of symptoms, and in the severe form it progresses to respiratory failure. So possibly most people will get this virus, but the question is, are we going to have a lifelong immunity? How long is our immunity going to be for? And the vaccine is going to be in place. So even if everyone gets it now, there's still a risk we may get it again later. And that is something we need to still keep at the back of our mind, that this virus is not going to go away quickly. So we have healthcare providers who are immunocompromised from their own medical issues. And what can we do for those patients? And the question is, can we look at Plaquenil as a pre-exposure prophylactic medication? And that's going to be in research right now. We're looking at different studies, looking at that question. And then healthcare providers who are being exposed as nurses in the emergency room or other providers, can we use, hydroxychloroquine and Zithromax as post-exposure prophylaxis or treatment options? So it's very early in those questions. We have very encouraging data. So I tell healthcare providers something you really need to consider, and to consider starting, and if there's good data to support this, and it looks like we're developing data over time. The question is, by the time we get that data is 3 months from now. So can we preempt this by starting medications? That's a good question. There are shortages right now of some of these medications, so we need to be very, very careful how we use those medications. And I think we need to ask ourselves, what are we fearful of? We're fearful of being sick. We're fearful of dying. We're fearful of the society we are in today is not going to look the same like it was 3-4 months ago. And those are all relevant fears, but you need to be educated. You need to control your fears and try to find a strategy that your fear doesn't overwhelm you. And that's going to be very important moving forward, because what happens in 6 months from now when this virus comes back again? Are we going to be similarly scared, or are we going to be much more confident that we can handle it like we did the first time around? So the issue of mental health will be very, very critical and crucial. A lot of people have post-traumatic stress disorder from this, especially healthcare workers. I worked with several healthcare workers after 9/11, and 20 years later they're still dealing with post-traumatic stress disorder, PTSD, and we'll probably see a significant amount of PTSD moving forward, especially healthcare workers who've been dealing with sick patients and seeing a lot of patients dying in front of them. And the choice of who goes in the ventilator and not going in the ventilator has become such an important choice. And now they're making it almost the point that do not resuscitate someone who is dying from coronavirus, and that's going to be a new move and a shift.